We are continuing our focus on health and wellness this Thursday, and unfortunately, deaths from heart disease are on the rise. I recently spoke with cardiologist Dr. Dean Karalis all about what we need to know about heart health. Let's take a look. Deaths from heart disease surged almost 5% at the start of the pandemic, the highest level in almost a decade. Delaying treatment due to COVID has caused plenty of concern in the medical community, but getting people to pay attention to their cardiovascular risks is a big challenge. Here to explain what everyone needs to know about their heart health is cardiologist and lipidologist at Cardiology Consultants of Philadelphia and Jefferson Hospital, Dr. Dean Karalis. Dr. Karalis, thanks for being here.
Well, thank you for having me on.
When it comes to heart disease, what has the problem been during COVID?
Well, COVID's been a challenging time for all of us in this country. But one of the things that often is not recognized is because of the pandemic, many patients have either neglected or delayed their preventative heart care. That is, they've not gotten into their doctor's office. They haven't had their blood pressure checked, their cholesterol checked, their blood sugar checked. And if those risk factors are unrecognized and untreated, the concern is that that's going to lead to an increased risk of both heart attack and stroke down the road.
Are people generally unaware of their risk of heart disease? And if so, why?
Yeah, people are unaware and people are fearful, about dying from a heart attack or stroke, but they often don't recognize the risk factors that actually lead to heart attack and stroke. And that is that those risk factors are silent. High blood pressure, diabetes, high cholesterol. It doesn't cause symptoms. The symptoms occur when you're admitted to the hospital with your first heart attack and stroke. So I can't emphasize the point more strongly. People need to take charge of their heart health, and they need to know what the risk factors are for heart disease. Smoking cigarettes, high blood pressure, high cholesterol, and not just bad LDL cholesterol, but also high triglycerides and also elevated blood sugar. They need to know their numbers. They need to be able to talk to their doctor about plans of action to get the risk factors under control if any of them are elevated, their blood pressure, their cholesterol, or their blood sugar.
What should Americans be doing to prevent their risk from heart disease?
Yeah, so that's a great question. And again, the first thing is to recognize that you have a risk factor. So again, know what your blood pressure is, know what your cholesterol and triglycerides are, know what your blood sugar is, and if you smoke cigarettes, do all that you can working with your healthcare provider to quit smoking. And then have the discussion with your primary care or healthcare provider about, are my cholesterol levels? Is my blood pressure level? Is my blood sugar at an optimal level? And if they're not, develop a plan of action working together, the patient and the doctor as a team, to address those risk factors and get them under control. And lifestyle first, good diet, more walking, exercise, and if needed, medication to control the risk factors to prevent that first heart attack or stroke down the road.
What is the overall cost of heart disease in the U.S.?
Yeah, this is a sobering fact. The cost is loss of life of Americans. And many Americans who die from cardiovascular disease, that death could have been prevented if the risk factors that were led to the heart attack or stroke were addressed in the first place. So again, know your numbers, know your risk factors so that you can address them the next time you see your healthcare provider in the office, or even if it's a telemedicine visit. Know your numbers and know your risk factors.
And where can the public get more information to help prevent heart disease?
Yeah, there's a lot of good information out on the internet. A great website for your viewers is to go to truetoyourheart.com. And again, I would encourage them, go to the website, learn about what the risk factors are for heart disease, and then be prepared when they go to their healthcare provider's office to discuss whether their risk factors are there and are they controlled. And if not, what's the plan of action to get these risk factors under control in order to prevent that first heart attack or that first stroke as these people get older.
Well, thank you so much, Dr. Dean Karalis, for joining us today with this important information about heart disease.
Great. Well, thank you for having me.